The primary endpoint of the study was overall survival. When we look at the patients that went on this study, it was pretty well balanced. Actually, about 40% of the patients were Asian in both arms. It looked like most patients had received gemcitabine. That was the physician choice for most patients, but docetaxel was used in about 25% of patients. Unfortunately, the primary endpoint, overall survival, was not improved in the Eribulin arm. It looked to actually directly overlie the survival of patients who received standard chemotherapy. So there was no advantage in the Eribulin arm in that sense. Likewise, for progression-free survival, the hazard ratio was 1, and the response rates were surprisingly about 15% in the control arm, and that was about where they were in the Eribulin arm. So the conclusion in terms of efficacy was that Eribulin was not superior to standard chemotherapy or physician choice drugs that we routinely use in patients who are candidates for third, fourth line therapy. But there is a take-home here that Eribulin did have activity. There was a response rate, a disease control rate, progression-free survival, and overall survival we'd expect to see with chemotherapy.